Well, incredibly welcome to the webinar this afternoon, which again has been organised by the UCD Alumni Relations team. What we've got for our topic today is your dog and its health. And being vets, we like this to be as informally formal as possible. So we're looking forward to obviously a lot of information, but also hopefully a little bit of interaction and maybe a little bit of fun as well. My name is Rory Breathnach, and I'm the clinical director here in the vet school in the veterinary hospital for the last number of years. And amongst one of my colleagues, one of the team, is Kevin Murtagh. Kevin is a graduate of UCD, so basically I taught him all that he knows, and if there's any problem with the questions, you can take that up with me. But in addition to that, Kevin went on for special postgraduate training, and he's now a European specialist in internal medicine. He concentrates on internal medicine and also in the area of emergency and critical care as well. So he's really well versed in a whole lot of problems that arise in dogs, and obviously he's very much looking forward to this. The format we're going to do is going to be as simple as possible. Kevin is going to give a short presentation for about 20-25 minutes, where he's going to touch on many different areas like the new puppy, what you need to know about vaccination and feeding and so forth. And after that, then we'll have a question and answer session, which of course is open to the audience. We've had a huge number of questions already given through the actual email account prior to this, but if you have any other questions that you do want to pose, will you please use the Q&A button, which is present at the bottom of your screen, and then we'll feed those questions in. But without further ado, and with absolutely no cost whatsoever, I'm going to hand over to my colleague, Kevin. Kevin, the floor is all yours.
Thank you, Rory, and welcome everyone. And I hope you enjoy the next short presentation. So I was asked to, I suppose, pick out a few features regarding the new puppy and what's important both before we get our little puppy and what to expect thereafter. So it's hard to cover everything, but in a short space of time, but I tried to pick the most important areas. So I suppose the points that I wanted to cover is, first and foremost, even before we get our puppy, we do have to think about, you know, the cost of a puppy. Because unfortunately we do see puppies surrendered because owners can no longer afford to look after them, and for other reasons as well. So we'll talk about that, and I wanted to touch on vaccination, which I think is something that's very, very important, worming, flea treatment, a little bit on diet. And then a couple of slides just touching on neutering really, and when should we do it and why, and what are the pros and cons around neutering our little pets. So the first thing is to discuss, I suppose, is, you know, puppies are expensive, and especially some of our more designer puppies. And I suppose we frequently see many different breeds in our neighborhoods, and you know, I've certainly seen an increased frequency in terms of French bulldogs especially, and little dachshunds. So I did a little search to see just roughly how much each of these little puppies would cost, and they do cost a huge amount of money. And I suppose, just for example, a French bulldog could cost in excess of 3,000 euros per puppy, and a dachshund could be 2,000 per puppy. Some are even more expensive. And I suppose that is important because we have to not only do we have to have the money to pay for that breed should we want that, but there must be there will be ongoing costs for that little puppy as well. And the estimated cost for a puppy is probably somewhere between 2,000 and 2,500 euro per year. So that's quite a substantial amount for a little puppy. And it's important that we recognize that, so that we know we can afford to look after that puppy correctly for the rest of his or her life. And as well as that, I suppose some of these particular breeds will come with some breed-related costs as well. So, for example, we talked about the Frenchies. And we know that, you know, a Frenchie is a brachycephalic, which basically means a squashed nose dog, and some are a little bit more squashed than others. And they can need surgery potentially if they have upper airway problems. And the dachshund that we mentioned as well, also a breed that can be associated with more problems. One in particular is disc disease, intervertebral disc disease. So these things have to be considered before we get our puppy then as well. And I think we recognize, because of the way owners look after their puppies now and the veterinary care that's available for them, dogs are absolutely living longer than before. And even if we have, you know, large breed dogs can live till they're 8 or 9, small breed dogs 10, 14 years of life. So we recognize that dogs are living longer as well. So we have a decade of commitment to this little creature, and it's important that we recognize that before we acquire our little puppy. And that's important because, you know, I suppose we all know that during the year, especially around Christmas time, there can be abandoned puppies and dogs, and there are some numbers here that were taken from Irish Independent Dogs Trust. And you know, in 2017, 13,000 puppies abandoned or dogs abandoned in Ireland. 2 years later, 2019, just under 10,000 that entered the pound system. And just looking at, you know, that tight Christmas period, almost 200 requests to surrender their puppies. So it's very, very important that before we consider getting a little puppy, that we know that we have a commitment to them, both cost and other. So that's just something I wanted to mention at the start. And then we decide, yeah, you know, I'm ready to have a puppy and I can look after this puppy really, really well. And the second thing then that we're going to have to decide upon and do are bringing our puppy for his or her vaccinations. And there are sort of two groups of vaccines that puppies require. And the first group are the core vaccines, and these are recommended worldwide. And these provide immunity to a lot of the infectious diseases that puppies can be quite susceptible to. And certainly as a vet and a practicing vet, and especially in emergencies, you know, you can see quite a lot of parvovirus in unvaccinated puppies, and it's a horrible disease. And puppies can turn very, very quickly from being happy, healthy puppies to being incredibly unwell and potentially die from parvovirus. So this is something that is quite avoidable through vaccination. Other things that core vaccines cover would be distemper and adenovirus. And we also have not only core recommendations, but non-core vaccines, which are, I suppose, they're recommended as optional optional vaccines, and they would include things like leptospirosis. Now, certainly in Ireland, we definitely have leptospirosis in Ireland, and so for me, that's something I would always recommend that our puppy has as well. So when do we start vaccinating our puppies then? Because that's probably one of the first things that we're going to have to do once we acquire our little puppy. And the determination to vaccinate our puppy is dependent on the antibodies that this little puppy received from his or her mum. So these maternally derived antibodies are acquired from the mum, and they protect our puppy for the first 4 or even 8 weeks of life. And these antibodies are generally starting to wean around 8 to 12 weeks of age. And at that stage, that's when we want to start actively immunizing our puppy. Because if we did it beforehand, it may be the maternal antibodies that are taking care of the vaccine and not the puppy's own immune system. Now, it should be noted that in some cases, those maternally derived antibodies can last longer in some puppies than in others. So that's sometimes a reason why we can get vaccination failure in some puppies. And generally, the recommendation is based on these maternally derived antibodies and the presumed time of weaning of these antibodies, we generally recommend that puppies have their first vaccine at 6 to 8 weeks of life, and then they're going to get their next vaccine 4 weeks later. And we're going to vaccinate that puppy until he or she has a vaccine at or after 16 weeks of age. So, for example, if our puppy has his or her first vaccine at 12 weeks of age, that puppy should only need one more vaccine at 16 weeks of age, 4 weeks later. However, if our puppy started the vaccination course at 8 weeks, that puppy will need another vaccine at 12 weeks, and that puppy should get another vaccine at 16 weeks to be sure that the puppy seroconverted that vaccine and that the maternally derived antibodies did not cause a problem. So it really depends on what stage you start the vaccine process as to how many vaccines that little puppy will get. But then once that's done, that's our puppy vaccines all done and dusted. And then that's us done until booster time. And traditionally, boosters are given at about a year of age after the puppy vaccines, so our adolescent time really. And that is again to ensure that we have a protective immune response in that puppy. Following this, then, as we've discussed before, the two types of vaccines, we have our core vaccines and our non-core vaccines. Once we've done our first booster, that puppy should not require a core vaccination for 3 years with any modified live vaccine. Now, the non-core vaccines, which we discussed would be something like leptospirosis, that still needs to be given yearly because those antibodies wane very, very quickly. So that's sort of vaccinations in a nutshell. I suppose that's going to be the first thing we do. We're going to concurrently want to worm our puppy. And we get all types of, worm infections in puppies. The most common one that people talk about are roundworms. And these can cause, every puppy is going to have roundworms. But heavy burdens can cause all types of problems, including a GI obstruction, so an intestinal obstruction in a puppy. That is not impossible. And one thing that we sometimes forget, some of these roundworms are what we call zoonotic. So they can actually spread from puppy to human to owner. So we do have to be a little bit careful and be very religious, I suppose, about treating our puppies for roundworms. Other worms that puppies can get are tapeworms. One tapeworm actually has an interaction with the flea. So worming and flea medication sort of go hand in hand. Other types are hookworms and whipworms. So most people will start treating our puppies from about 2 weeks of age. And generally we will worm every 2 weeks until that puppy is 12 weeks of age. Then we do it every month until they're 6 months, and then we do it every 3, maybe 4 months thereafter. So regular worming is very, very important for our growing puppies then as well. One worm I wanted to talk about, just to mention, so we talked about traditional worm infections, and one other infection that we can certainly see in our dogs, especially in Ireland, is lungworm. And it's given a fancy name called Angiostrongylus vazorum. And these adult worms live in the pulmonary artery, so within the respiratory system, and even the right side of the heart in very heavy infections. And they can cause respiratory signs, which of course can be life-threatening, and can also cause lots of clotting issues. So they impair the dog's ability to clot. And that can present clinically to someone as a vet as bleeding. And that can be bleeding potentially anywhere. And the treatment for that is a particular type of wormer. And it is very, very preventable by using regular even spot-on worming. So lungworm is something as well that we sometimes forget about in our growing puppies that could become an issue later on in life if we don't use the right product. So we mentioned flea treatment as well, and that little, I suppose, connection between fleas and worms. And fleas can certainly cause all types of problems in our dogs and in our puppies, including skin irritation, hair loss, and some animals can even have quite significant allergies to fleas, to the flea saliva. And remember, our little puppy, they're potentially quite a small little puppy, a small little creature, and these fleas could cause quite significant blood loss anemia. So puppies can present to us, and we've had them here where they have been super, super pale because of anemia, and actually the cause was blood loss through fleas. So that's certainly something that we have to consider as well. And it's very important if we identify a flea infestation that we not only deal with the current infection in the patient, in the little puppy, and his buddies or his or her buddies or siblings, but also we need to deal with the environment then as well. So that's going to be probably one of the next things that we have to watch in our puppy to ensure health. Another very important thing then centers around diet for our puppy. And you know, a proper diet is vital for a puppy's development, and I suppose life in general. And I suppose we always want to avoid obesity, which can lead to lots of other problems, including extra pressure on joints and degenerative joint disease. And we would always hope to feed our puppies something that's well balanced. And that will change with age and sometimes breed as well. But there are certain considerations that the diet will take into account, certain prescription diets will take into account at different stages of that puppy's development. So we know that there are certain requirements between 4 and 12 weeks of age, because we know that those maternally derived antibodies that we mentioned previously when we talked about vaccination will be weaning at that stage, and good nutrition is required then for a good immunity. We know that from 8 weeks onwards, skeletal structure is developing, and so calcium and phosphorus balance is essential. And if we get that wrong, we can get all types of problems with our calcium balance and our homeostasis, and that can lead to problems with the parathyroid and the skeleton then as a consequence. And then as the puppy gets bigger, we know that they're going to be building body mass, and so protein is going to be more essential at that stage. And then that's going to lead in then to our adult diet. And we want something that's balanced, and we certainly don't want to gain weight in that little dog as well, because that will lead to a whole plethora of other conditions. But there are lots of prescription diets out there that try to meet those needs of those little puppies then as well. So it's going to really change based on the stage of that puppy's development. And before you know it, you've got your little puppy, you've gotten him or her vaccinated, we're doing regular worming and flea treatments, and we are giving a prescription diet for that little puppy that we know is balanced. And before we know it, one of the next, I suppose, questions that we're going to have to think about is, shall we or shall we not get our animal neutered? So shall we get our females spayed and our males castrated? And I suppose it's like anything, there's pros and cons associated with doing that. I suppose one thing we know is that neutering is probably the most common surgical procedure performed in our smallies. We know it's the most reliable and permanent reproduction control method. And generally, neutering traditionally has been done around the 6 or 9 months of age, but there's a little bit of a lack of evidence as to why we've always picked that age. We know that puberty is generally reached at that age, so perhaps in the past it was to prevent breeding. So we've already talked a little bit about, you know, there's pros and cons associated with everything, and I suppose some of the benefits then of neutering, there are societal benefits, so population control, and that will prevent some of the previous things that we talked about, you know, welfare issues and unwanted puppies and unwanted estrus behavior, which, you know, can be quite difficult to manage in a home environment for sure. There are also some health benefits for both the male and the female. So from a female point of view, one of the health benefits would be to prevent false pregnancies. And this is something that we see not uncommonly in practice, to the point where it can be quite severe. The female can look like she's genuinely pregnant, can produce milk, and so it can be quite upsetting for that female and quite a difficult time for them. Another health benefit would be to prevent a pyometra, which is quite a serious condition where they can develop an infection in the womb, and that can be open or closed, and the closed version can be those dogs can get very, very sick, and generally that's treated with surgery. So now we have to do an ovarian hysterectomy at a time when our dog is sick as well, so not ideal. Another health benefit centers around the prevention of neoplasia, and so obviously one neoplasia that could be prevented would be reproductive neoplasia, but also mammary neoplasia. And there have been there have been, like this journal article that I've put down here, some publications looking at the benefit of ovarian hysterectomy at the time even of tumor removal, that there might even be a benefit even at that stage to prevent further mammary tumors. So there definitely seems to be some benefit around that. And then in males, one benefit centers around the prostate. And dogs that are castrated are far less likely to develop infections, both acute and chronic prostatitis. Again, that is an infection within the prostate, can be a very serious condition, a very painful condition for male dogs as well. So there are definitely a lot of health benefits. Now, like I said, you know, there's not going to be just positive. Potentially, there could be some negative, longer-term complications from spaying or neutering our animals. And one of the more commonly discussed ones centers around urinary incontinence. And that's generally something we see more in female dogs that are neutered than in males. So we know from one of these studies that I've mentioned here, the prevalence of urinary incontinence in intact, unneutered females centers around 1%, but it does increase in spayed females to 3.14%. Now, we don't see an increase in urinary incontinence in males that are castrated, so that's less of an issue for a male. But it is something that has to be considered for our female dogs that we recommend spaying to. Other issues centered around skeletal issues, which we'll discuss a little bit. There is some debate over whether dogs develop excessive weight after they're spayed, and that has to be considered, and maybe even neoplastic disorders. So let's go back to the overweight issue. That's always something, and especially through diet, that we want to try and avoid. And some dogs do seem to be, you know, very predisposed to putting on weight post-neutering. However, whether this is true or not, there's no real evidence for that. And as we've already mentioned, you know, a lot of dogs are spayed around about that 9 months of age. And so that is often the transition from being an adolescent to an adult as well. And perhaps that dog just needs less calories now than she needed within 1 month ago. So perhaps we're feeding these animals a little bit too much post-spay as well. And that's the reason that they can gain a little bit of weight. Neoplasia is something, it's a very interesting topic when you talk about getting animals neutered, and the role of sex hormones in the pathophysiology of some of these neoplastic diseases still remains unknown. And some studies suggest that when the animal is spayed, it could confer a benefit that we've already discussed, reproductive and mammary benefits, while others suggest that there could be a detriment. So, for example, I've taken out just a handful of breeds from a study that was published several years ago. And again, it sort of, I suppose, outlines the importance of the breed and the sex of the animal in terms of neutering and whether there's a link to neoplasia. So for the border collie, for example, the suggested guideline for neutering, given that there's an increased risk of cancer, is holding off neutering until beyond a year of age. Whereas other breeds, such as the German Shepherd dog, there doesn't appear to be any involvement of neoplasia, whether you get males or females spayed at an earlier age. So it very much depends on breed and sex. So again, neutering is something that I think is important and I would recommend, but it's something that must be discussed, and we have to talk about both the benefits and the disadvantages of doing that. So I suppose in conclusion, what would I do if I wanted to get a new puppy, and what would I consider doing? Well, first of all, I think very hard before getting a puppy. It's an absolute privilege, but it's a huge responsibility. And that little puppy is going to be with you, hopefully, for 10, 12, 14 years. So we have to be able to look after that puppy correctly. Would I buy a designer puppy or would I rescue a puppy? Looking at those numbers, I personally would always rescue a puppy. I think there's a lot of puppies out there that need good homes, and that's what I would do myself. And I understand that perhaps there might be more behavioral issues because maybe that puppy hasn't been socialized correctly because of the rescue situation, but that's probably what I would do. I absolutely would vaccinate my puppy, and I would do it based on the WSAVA guidelines, which centered around what we discussed previously: core vaccination and non-core vaccination. And I would vaccinate my puppy and ensure that the last vaccine was given at or after 16 weeks of age, and then do my booster vaccine 1 year later. And then my core vaccines are only needed every 3 years if it's a modified live vaccine. I would routinely worm my puppy, because I certainly don't want my little puppy having roundworms or something like lungworm and succumbing to it, the consequences of those infestations. I would routinely flea my puppy as well, and keep on a balanced puppy diet. And then the big question centers around neutering. So I would neuter because I think I see so many, I suppose, complications from not neutering, whether that is infections in the uterus, so a pyometra, and seeing very sick dogs as a consequence, or infections within the prostate, and again seeing very sick male dogs and painful dogs as well. So for me, I would neuter. But depending on the breed and the sex of the puppy that I would get, I might wait longer depending on what I decided to get. So if it was a collie, perhaps I would wait until they're over a year. But if it was a German Shepherd, maybe I wouldn't wait. So it would depend on the breed and the sex of the puppy. But I think it is an important thing to do. So in summary, as I say, I think it's a privilege to have a little puppy, but they're a lot of work. And they cost a lot of money as well. And there's a lot of things that we need to do to keep them healthy and keep them happy. But I think in the end, I think we all would like a little puppy, and it's something that I think is an absolute privilege. So I think that comes to the end of my brief summary of the little puppy, and I'll hand back over to Rory, and I'd be happy to take any questions.
Thank you very much, Kevin. To be honest, Kevin, you were much better than I thought you'd be. And for those people who don't know, Kevin's from Longford. So the reason he'd get a rescue puppy is he wouldn't spend the money for 2,000 or 3,000 on a designer breed. I think obviously Jenny's just posted a message there because many people were asking if the slides were going to be available afterwards. And as she pointed out, this presentation is going up on the Alumni Relations Team YouTube channel. So everything will be available, the entire recording. Okay, Kevin, listen, thanks a million for that. There's been a lot of questions coming in. One thing I think I do need to point out is that obviously we can't ask Kevin to contradict your own vet. So if, for example, your veterinarian who's examined your dog or cat or whatever it might be says do A, B, and C, Kevin's not going to necessarily contradict. And again, just to make it clear, we're not just answering questions on puppies, we're answering questions on older dogs as well. So in as much as possible, I've tried to put as many questions into a theme to make sure that I'm getting as much input as I possibly can. So please excuse me if I don't actually put your precise question to Kevin, but I'm going to put a variant of that thereof. So Kevin, we're getting a lot of questions about diet, and you've covered some of the main points, but other issues that arose was, where do you stand on the choice between a raw food diet and processed food? And also, what would you do when dogs get bored with dry food when they're getting the same every day?
Yeah, so it's an excellent question, and it comes up time and time again. And I am not a big advocate of raw diets, and I know there are lots of people that say that their dog is only having good GI health when they're on a raw diet, and I absolutely accept that, and I've seen cases here in the hospital. However, I've worked in the UK, and raw diets have been associated, and there are many published cases now of infectious diseases in our pets as a consequence of certain raw diets. And I'll always remember I had and it was a cat who was fed a raw based diet, and that cat came into me for respiratory infection. That cat turned out to have tuberculosis, and all of the 3 in contact cats were fed the same raw diets. They all 3 had tuberculosis as well. And then it turned out that there was basically like a mini outbreak of tuberculosis in UK cats that were fed this raw-based diet. So Mycobacterium or tuberculosis is certainly something we see, among other things. There has been a similar outbreaks of tuberculosis in raw-fed dogs as well in the UK, so that's been published too. So for me, I am not a big advocate of it because I do worry about the infectious component to it. Now, I completely understand, and I've had cases here, as I say, where owners have tried everything, every commercial diet, because their dog has had GI signs, diarrhea, vomiting, weight loss, and literally the only thing that helped that dog was a raw-based diet. So I accept it works, but there could be complications associated with that, and those complications could be catastrophic.
Thanks very much, Kevin. Another thing that came up with regard to gastrointestinal disturbance is Giardia, this protozoan infection in puppies. Quite a few people seem to have young animals with that problem. Yeah. What would you recommend in that case?
So yeah, it can be a huge problem. And usually if puppies have Giardia, they've acquired it from an environmental source. And sometimes we can treat our puppies, but the environmental source remains, so that puppy reinfects him or herself. And so sometimes we can treat with, I would recommend fenbendazole to start with, but we must remember to treat all in contacts. That's the super important thing, and trying to identify where that environmental source is. The other really important thing to do is I always bath our puppies and dogs at the same time as treating them with the fenbendazole and the in contacts as well. So I think it can be a very tricky disease to treat, and I think sometimes it centers around reinfection as opposed to failure of infection. Sometimes we reach for an antibiotic, metronidazole, and some dogs seem to respond to that if they don't respond to fenbendazole. But I do wonder if maybe it's a reinfection issue as opposed to a failure of fenbendazole.
Great stuff, whatever. So we've got about half an hour left because we have to finish up by 5 p.m. And based on the number of questions, Kevin, we're just going to pepper you, okay? We're going to get our value out of you this in the last 30 minutes. So one of the people listening in has got a problem with their older dog who's just recently begun to drink a lot of water. Mm-hmm. Is that a common problem?
So this is something we see a lot, and that's often a reason for referral. And drinking a lot can... It is always a pathological thing, so it's always abnormal. And I think owners are in the best position to see that, because suddenly they see, well, the bowl is now completely dry as opposed to only been half drunk previously. And especially if it's sudden as well. It can indicate a whole range of diseases, from diabetes to liver disease, kidney disease. It can center around thyroid if you're a cat. It can center around other endocrine disease like Addison's or Cushing's. So there's all types of diseases that can cause a dog to drink excessively. I would say it's always pathological, so there's always a reason behind it, and often it's a disease that can be, if not fixed, then managed. What I always do though is I tell my owners, because sometimes owners come in and say, yeah, maybe drinking a little bit more. I get you to actually quantify it. So over a 3 or 4 day period, actually measure out how much water you're giving the dog. So say they normally drink 1 litre, we'll put out 3 bowls and have maybe 2 or 3 litres there, and measure how much that dog drinks per day. And the definition of polydipsia, or drinking too much, is the dog drinking more than 100 mils per kilogram. So like a 10 kilogram dog, I would ask them, are we drinking 1 litre of water a day or not? So determining the quantity is very, very important before you can say it's polydipsia or drinking excessively, and then I look for a cause, which you almost always find.
Great stuff. Okay, just before we come to the next question, there's quite a few people asking, does the vet school either A, adopt dogs, and clearly we don't, or we don't adopt from here, and second of all, do we recommend any specific diet? And clearly we don't get into one manufacturer over another manufacturer. I think, as Kevin pointed out, you'll find that a diet may suit a particular dog brilliantly, but not the next dog. So you just find out what is ever suitable for yours. So there's no one golden bullet out there, I'm afraid. Kevin, another really interesting point, and this shows how things have changed from when I was young. People taking their pets abroad for summer. And they're worried about the fact that when they go to Spain or Italy, whatever, what are the exotic diseases that either A, they may pick up or bring back? And another person is worried about Lyme disease. They're talking about walking their dog in the Phoenix Park, and they've heard a lot in the literature about humans with Lyme disease.
Yeah, absolutely. I mean, so for the first point, I suppose, dogs that travel abroad potentially are at risk of picking up an exotic disease. And certainly when I worked in the UK, we saw that quite a bit actually, and that could, and also it comes from, not even dogs that holiday abroad. It also comes from dogs that are adopted from abroad, and they can bring diseases back with them then as well. And we see diseases now like heartworm that we never saw before. And heartworm infection can lead to heartworm disease, which can be a very, very serious disease, a very serious lung problem. And we've treated dogs here with that. And it's not something that generally we're going to be able to fix. It's going to be something that we manage, but that dog is probably going to be left with permanent problems in their vasculature in their lungs. Leishmania, certainly another thing that we can see, and that's something we see in Mediterranean areas. Ehrlichia, another thing as well. So Ehrlichia canis and platus, affecting our white blood cells and our platelets, and that's certainly a serious disease that can not only affect those cells, but then affect our bone marrow as well. And even Leishmania can present in many different ways, and I've had cases of Leishmania that had come from abroad and they present with really painful joints, or they can have, or other animals then could have kidney issues. So definitely there are exotic diseases that we need to be careful of and aware of. So I would always advise owners to do a little bit of research about where they're going and see what infections are there, take every preventative possible. So understanding how that disease is transmitted to my pet is important. So whether it's Leishmania like a sandfly, or whether it's a particular type of tick, etc., that might transmit it, that's very, very important. And using preventatives to prevent that from happening. Now, the thing with Lyme disease, so Borrelia burgdorferi, is something that we can absolutely see. Yeah, humans get it. Dogs can get it. I personally have not seen it in a dog in Ireland, and we do look for it because Lyme disease is it can present as very vague clinical signs, maybe a bit of pyrexia, maybe some proteinuria, whatever it might be. We do look for it, and I have yet to see a positive result here, but it's certainly possible. And sometimes we had suspicions of cases of Lyme disease in the UK. Still not sure they definitely were, I have to be honest. Because it can be quite difficult to diagnose as well. But so far, I've not seen a case in Ireland. Okay. But it should be in the country, yeah.
And that's really reassuring. Can we take the travel question to the other end of the spectrum? People aren't going to Spain, or they're not going to Italy. They want to go down the road with the dog in the car. But when they do it, the dog keeps getting sick. So it's the whole issue of motion sickness. How would you approach that if it was a major problem?
Yeah, so absolutely, that can be a huge issue. And that can, that dog like us, it could take that dog the day to get over that sickness, and can ruin the first day of their travel. So I personally think one of the best things is giving an anti-sickness. And sometimes I'll give it the night before travel as well. There is one brand just the brand that I use, and it's the one that's available to us, and you can get it from your local veterinarian as well, is Serenia Meropitant. And I think that seems to work really, really well. And I've had some really sick dogs traveling. They've had Meropitant the night before they travel, and they've had an uneventful travel.
Good stuff. Okay, I'm now hopefully going to be able to allow you to put somebody's mind at rest, whatever, because somebody's very worried about the fact that they've got a dog whose sister died last year of cancer. And they're kind of worried, does this automatically increase the risk of cancer in their dog? And if so, what should they be doing about it?
Yeah, no, it's a really good question, actually. So I would say, look, don't worry, that just because a relative died of cancer, that does not mean that your dog is going to get the same or succumb to the same fate. So that definitely, I wouldn't worry from that point of view. However, it is something that we have to consider. And what can we do to try and pick things up earlier? And certainly one of the things that I would absolutely advocate for older patients would be routine bloods and examinations at the vets. And it just came to mind today because I had a case that was referred to me, and the vet picked up slightly big lymph nodes. So that vet very quickly identified that this dog had a problem. So routine examinations, and I would say if your dog is going for a vaccination once a year, I would absolutely recommend a 6-monthly check as well for that slightly older patient. And I would also recommend doing some bloods intermittently, because you'd be very surprised what can be picked up on just a routine blood test, whether the kidney values have increased or the liver enzymes are increased, or maybe the calcium is creeping up, and that could indicate an underlying neoplasia as well. So I think getting your veterinarian to have a little look at them every 6 months and doing bloods every 6 months or 12 months, I think is well worth it, along with a urine sample. We always forget the urine, don't forget it. Yeah, very important.
Never forget the urine, okay? But in general, she shouldn't worry unnecessarily about this, Kevin, no?
Absolutely, absolutely. But if you want to be proactive, examination every 6 months and some bloods, I think that's a good idea.
Great stuff. Okay. Now, one thing that's often very kind of traumatic for people is when they witness their dog having a convulsion or an epileptic type fit, particularly when it happens for the first time. Yeah. So one of the listeners wanted to know if you have any advice on the long-term management of a patient with epilepsy.
Yeah, absolutely. And unfortunately, it's not an uncommon event. And always, I would say, seizures, if an animal has a genuine seizure, again, there's a reason behind that. Now, whether the reason is in the head or whether the reason is in the body, so a metabolic cause, that needs to be determined, because the best treatment is going to be finding the underlying cause and trying to treat that. So whether that's liver disease or a shunt or low glucose, that needs to be investigated. Now, and usually local vets are happy to do that, and certainly when they want to refer up to us, we can do more advanced imaging, whether that's MRI, and we have MRI on site here, so our MRI is constantly going, imaging, etc. Now, so I think finding the cause is one of the most important things. Now, what do you do in the home situation? Well, if it's the first time, it's very important that that dog doesn't traumatize themselves, especially their head. So usually I throw down either pillows or towels just to protect their head. Don't stimulate them, so don't pick them up, don't cuddle them. That could make it worse, and that's important. And I would turn off all sounds, so radio, TV, and I would pull the curtains and have a nice calm, dark environment, and give that dog time to come round from that seizure. I know it can seem like it's forever, but generally seizures last for up to 30 seconds. I do really worry when seizures are lasting longer than 5 minutes. That's like a status, and I'm really worried, and that dog does need to go to the vet then at that stage. When that dog then recovers from the seizure, especially if it's the first time, I always urge owners to be super careful. Dogs have what's called a post-ictal or post-seizure phase, and some dogs just drink water. Some dogs are hungry and they want to eat something. Some dogs can get a bit aggressive, so you have to be really careful of a dog post-seizure. And that's a good, also during the seizure, make sure you don't try and manipulate their mouth or anything like that, because you could get bitten as well, and that's important that you don't get hurt yourself. But when that dog recovers from the seizure and you're happy to go to the vets, I would, and then the vet should do a workup for that case.
Great stuff.
If it's a case that you have had seizures before, your vets can sometimes send you home with some rectal diazepam. I know it doesn't sound like a very nice job to do, but you can pop the diazepam up their bottom, and that can make a big difference then as well. It's not the nicest job.
Sure. I'm sure everybody's enjoying this over a cup of tea right now.
Sorry.
Those emotive words. Okay, that's brilliant. Kevin, when you were talking before, you gave the impression that having a puppy was just a joyful experience. It was like, it was life rewarding, whatever. But of course, many people have very destructive puppies, okay, who chew everything, and some even have aggressive puppies. Is that the line between, is he play biting, or is he actually just jumping up a bit too much? How would you advise people to try and cope with that?
Yeah, and it's always something that you have to be very, very careful of. And I do agree, sometimes it can be very difficult to know whether our little puppy is playing or whether he or she is a little bit naughty and may need some training. I would always approach your vet about it to discuss it, because sometimes it may be something like behavior classes. And certainly when I was in first opinion practice, we used to have behavior classes for puppies, and it did them the world of good to socialize with other puppies and to realize with other puppies what is correct and what is not correct. But sometimes that's not enough. And I would always urge owners to be very careful if they think their puppy might be a little bit aggressive or a bit naughty. Sometimes getting the advice of a behaviorist is very important at an early stage. Okay. But trying to determine what is sort of playing and what isn't can be very, very difficult. Sometimes the best place to start is enrolling your puppy once they're at the same stage of vaccination as other puppies. That should be safe, and going to puppy classes, and that can make a big difference.
Okay, a couple of people seem to get puppies from what they call working breeds or working lines, and they are very, very active. 6 months of age, they're jumping up onto the couch and jumping up on the couch or whatever. Will that settle down, or will they always be these hyperactive dogs?
They usually are a little bit, they have a lot of energy, but in my experience, yes, they do settle down. And sometimes it can take them about a year and a half to settle down. And especially if they go on to work as well, then they really do calm down as well. But it's a good point, because sometimes you can get some puppies that are bananas, and especially even Labradors or Retrievers, and they can still be a bit bananas at 2 years of age and 3 years of age. So sometimes it can take them a little while to mature. So some people even say it can be 4 years before they sort of just chill out a little bit. But working puppies absolutely have more energy. If they go on to work, that often settles them down. But usually after a year or so, I think they do calm down a little bit. I sort of like that, though. I know I don't have to live with the puppy, but I think it's hilarious.
Yeah, well, I just got a red and white setter puppy at the moment. It's absolutely ballistic. And all I can do is walk for 10 kilometers every night. Yeah. That is the only way literally I can just keep it
take the edge off the puppy.
It takes the edge off me too. Well, we're always talking about how Kevin is going from one end of the spectrum to the next. So on the one hand, it's fantastic to have a 6-month-old puppy just full of life, and you can't help but laugh. But then they get a little bit older and suddenly they become arthritic, and you start to feel, oh my God, this it's kind of sad to see it in front of your eyes as well. So what would you recommend to try and obviously maximize the quality of life and reduce the pain of any dog with arthritis?
Yeah, absolutely. And it is a very common thing that we see in our dogs. And absolutely, I think modifying their exercise is the first thing. So I would never force a dog to do more than they're able to do. And if you find that Molly or whoever is sort of lagging behind after maybe 15, 20 minutes, that's maybe her telling you, look, I've had enough, can we turn around? And sometimes trying to keep the exercise on level ground. I know that's easier said than done, but no big like hill climbs, etc., can make a big difference. Also, I think in terms of in the house, climbing stairs, that sort of thing, can put a lot of pressure on their joints, especially if they already have inflammation in them. So again, I try and avoid all of that. And if it meant that they used to sleep upstairs, I've had a lot of clients then that bring their bed and everything and downstairs, so they change where they're sleeping at night. And then I suppose the other thing is so apart from modifying their exercise, and we already talked about diet and being super careful that they don't gain extra weight. That's so important, especially when they were younger as well. But then we're at this point where they need pain relief. And there are lots of different painkillers that we can give our dogs, and I personally wouldn't be shy in giving those to dogs. One thing that we can give dogs is paracetamol, and that's a really nice analgesic to dogs. And probably one of the most effective are non-steroidals. There are loads on the market that you can discuss with your vet, from Metacam to Virocoxib to whichever non-steroidal is available. And I think that's something that they should get. Whether they need it every single day, they may not. They may just need it every second day as opposed to every single day. And it's about finding that balance between exercise, medication, weight, and what suits our individual patient. And it might change with age, obviously. Yeah.
And what problems do you find when they go on these non-steroidal drugs? I mean, they do a great job, but can they have problems as well?
Yeah, they can, absolutely. And certainly we've seen referrals here from dogs that have been on non-steroidals. But I do think of the amount of dogs that are on non-steroidals, and then the small population that develop an issue. But certainly one issue that can develop would be gastrointestinal problems, one of which could be GI ulceration. And that is something that we can try and avoid by always giving our non-steroidal with food. I never ever give it on an empty tummy. They must have either their breakfast or their dinner, and then they have their non-steroidal with that. If they, and there's things that we can watch out for, you know, black poo could suggest that maybe they've had a little bit of bleeding in the gut, or maybe they might vomit. There could be coffee grounds in it, or maybe there could be a little bit of fresh blood, and maybe the dog is just off food that day. Don't give the non-steroidal that day. So there are ways that we can ameliorate some of the clinical signs, or the adverse clinical signs that can be seen with non-steroidals. Sometimes we can see problems with kidneys and liver, but they are pretty rare, I would say, pretty rare. But yes, they're always this, when a vet will dispense non-steroidals for whatever reason, they will always discuss the potential adverse effects as well, but we watch out for those. Yeah.
Another person was asking about the whole role of physiotherapy and hydrotherapy. It's big in humans with any joint disease, whatever. Do you think it's got a role for dogs?
Absolutely. I think it's a fantastic way to get patients that have had surgery, for example. So we talked about our little dackies that have intervertebral disc disease and have surgery, and physio is a really important part of their recovery, as is hydrotherapy. And certainly in previous places I've worked as well, where there's been big teams of physios, and they work on the patients a couple of times a day, and they seem to get great results from them. So I absolutely do believe there's a role for that then as well. Absolutely.
Cool. After I qualified, my father came from a farming background, and when I was in practice, I initially was in small animal practice, and one day he just happened to come with me on a call, whatever, back to the surgery, and he could not get over how attached people were to their pets and the amount of money they would spend. And his giveaway comment at the time as we left was, you know, he said, "Rory, this keeps going. One day you'll even be brushing dogs' teeth." Right now we move on, like whatever, and the whole issue of dental care and brushing dogs' teeth, whatever, is just so common. Do you support that kind of approach to it?
100%, and it's like anything. I mean, anything, when you talk about disease, prevention is better than cure, and it's a really important part of their routine, I think, as well. And, you know, there are lots of doggy toothpaste out there that are beef flavored and this flavor and that flavor, and dogs don't mind it at all. And it's just a matter of getting them used to having their teeth brushed. So often what I tell owners is, sometimes I put the doggy toothpaste on my finger, just rub it on their gum line and just leave it there. And they think this is great. And then the next time, maybe after doing that for 2 or 3 days, we might try and brush their teeth with a little toothbrush that you can put on your finger or your thumb. And again, they get used to it very quickly. But I do think it is a very important part, because anything that can prevent disease is important. And we recognize as dogs get older, they are going to require a dental. And that's obviously different than you and I, because dogs are going to require a general anesthesia for that. Well, I don't want to GA my dog if I don't have to, especially if she's 10 or 11. I want to avoid that like the plague. But if it needs to be done, it needs to be done. But if we can prevent that, it would be much better. And it also comes into, you know, and again, my dad is the same. I come from a farming background as well. And one thing that was always done was like bones to dogs, because it's good for their teeth. Maybe it's good for their teeth, but it's certainly not good for their esophagus. And the amount of times that we see dogs that are referred into us because a bit of bone has gotten stuck in their esophagus is incredible. So personally, I would never, ever recommend bones for dogs.
Okay. Kevin, I've just had an email here from HR saying, this guy is recommending that UC staff stick their finger up the bum one end and the mouth on the other end. Where next? Okay. But it's all the part of pet care going on these days. Okay, a really interesting question from somebody, and they're asking about, say, white breeds, like white boxers are beautiful, but do they come with problems?
Say that again, sorry, I missed that.
White boxers, white dogs are very striking to look at. Yeah. Aesthetically very pleasing, but do white breeds tend to have more problems than?
Yeah, I mean, it's not impossible that, you know, you can get more problems sun related and cancers as well, and we see it in cats as well, where, you know, you get very little hair or coverage over their ears or their nose, and it can predispose them to certain kinds of skin cancers as well. So yeah, I agree that they are beautiful, but there, again, if that is the case, there are ways to try and minimize that from happening. And I used to work in Australia as well, and so I was that white boxer. I used to be the person with factor 100 on me, trying to avoid the sun like a vampire. So some days I could only go out at night. So same, you know, dogs were the same in that country, where, you know, if they were white, they had sunblock on. Or even that the zinc rub that they can put on as well, but sunblock was put on animals all the time. So there are ways to prevent that as well, and I think, again, it's about, yeah, prevention is better than cure, because we know, like, things like melanomas, squams, these things can be very nasty in dogs and can spread and can shorten their life for sure.
Okay. We're all really grateful when, you know, our dogs live to an old age, and we take that as being like a real privilege that your dog gets to 13, 14, 15 and has a full life. And then they get slow and doddery. And somebody's asking is, look, is this actually dementia? And if it is there anything we can do about it?
Yeah, it's a really good question, and I don't know if we can answer that, to be honest. I suppose we know that dogs can get cognitive disorders with advancing age. And there are some that advocate a medication for that to see if it might see if it would help. I'm not sure there's much evidence behind it, but I definitely recognize it as happening. However, it might look like our animal is slower for maybe central nervous system reasons, but I would always urge owners to think, is there something outside the head that could be doing that as well? Is our animal slower because maybe they got liver disease, kidney disease, maybe they have low blood glucose and they're having spikes of hypoglycemia? So I would absolutely rule out metabolic disease before I'd be thinking about a cognitive disorder. But absolutely, there are articles written on it. It does appear to be present in our dogs. There is a medication that has been advocated, and whether Vivitonum works or not is up for debate.
Up for debate, no problem at all. Okay, many people are very fortunate to have a dog with long floppy ears. And as some people say, they can smell the dog before they can see it or hear it.
Okay.
Ear infections and ear, hygiene is it's a major problem. Any tips for people in trying to, minimize the problem?
I suppose, especially when they're young, and we know that this might happen with age. Ear cleaning, I think, is an important thing to do, because again, it's about prevention and cure. Also recognizing that the ears are part of the skin as well, so that might represent a type of skin disease. And sometimes we can have dogs that, may have smelly ears, but they might lick their feet a lot, so they might have very stained feet, especially if they're white, like our little Westies and things, or maybe they're itchy in general. So maybe that animal has an overall skin problem that could be something as simple as diet responsive, or maybe the ears are an additional problem. And it's important, I think, that if we think there's a problem in the ears, that our vets have a look. And vets will take samples from ears to determine if there is like a yeast infection or a bacterial infection or both. And they'll take swabs for cultures as well, to because if we're going to put a medication down the ear because there is an infection there, we want to be sure that it's going to work as well. So I think prevention is better than cure with ear cleaning. Determining whether there's an overall skin problem is important. That could be something that could be diet responsive and no drugs are required at all. And then with advancing time, I suppose, that dog may need medication as well. And determining what is in that ear at the start, I think, is important. But Rory, that's probably your area. What would you say?
No, what I'd say is that you're the vet on show at the moment. No point passing the question to me. Kevin, what I'm going to do is we've only about 3 minutes left, so just kind of rapid fire 3 quick last questions, because again, there's been a huge amount of questions, and guys, we're really appreciative of how many people have kind of tuned in and all the kind of interaction that you've done with this as well. But I remember being at a veterinary dog exhibition in Berlin, and it was a dog accessory exhibition. And I kid you not, I stood beside a platform where dogs walked up and down, and they were displaying juicy couture coats and various other forms of things as well. So somebody's asked, does a dog actually need a coat in winter when they're out on a cold night for a walk?
I suppose it depends on the dog and the breed, because I suppose it depends how much coverage they have as well. So I would say, skinny, sparse-haired dogs, I don't see anything wrong with that. And if I had that dog, I would put a Gucci top on that dog too. But if they have a little extra padding and they're sort of a thick coat, no, not needed.
You know, my poor father is now revolving in his grave now, running with the teeth, with the actual fashion designer accessories that gets into us. Somebody just has a dog with Addison's disease, and they're kind of wondering just again about the long-term management of a dog with that disease.
Yeah, I mean, it's never nice having a disease in a dog, but we love when we find Addison's because it is generally quite easy to, well, relatively easy to manage, and that dog can have a completely normal life with Addison's. And it's been revolutionized, I suppose, recently because we now have an injectable type of what is called mineralocorticoid. It's called DOCP, and that is a fantastic drug, works really, really well, and it's generally given once a month. And we're recognizing now that lower and lower doses are needed from such a drug. So I think dogs can have a great quality of life with their monthly injections and their little bit of oral prednisolone then as well.
Okay, great. And just the last question before you finish up. Somebody's worried that the various antiparasitic agents that you talked about before, really important to treat dogs. Number one, they're worried that does a spot-on work as effectively as a tablet? And second of all, do they sometimes need to do a combination to take care of roundworms, tapeworms, lungworms, ectoparasites?
Yeah, so it depends on the drug that you're using, the spot-ons. Some spot-ons cover most things, some tablets cover everything. So it just depends on what you're wanting to treat. So in terms of, is there a difference in terms of, I suppose, effectiveness? No, I don't think so, because they're designed to work either via the skin or through the gastrointestinal tract. But it is important to determine what the spot-on does. So it might not do tapeworm, for example, but it might do lungworm, whereas the oral frontal or Milbemax might just cover everything. So it just depends what you want to cover. But in terms of effectiveness, no, I don't think there's a difference.
Brilliant. Look, I think, Kevin, you've kind of been on the podium for an hour now, and they fired various questions from all different angles at you. It's been pretty brilliant, and I think everybody listening in, you will agree, I did educate them well. I mean, I did a good job to get them to this level.
Where would I be without you?
Where would you be without me, whatever, okay? As you can see, folks, vets don't take themselves too seriously. I really, really hope everybody's enjoyed this. I'm sorry if we didn't get to your question, but I'm sure you understand there's been so many questions and so many participants, it wasn't entirely possible. I'm really, really grateful to the alumni relations team, to Jenny and Fiona for organising this on your behalf. I'm incredibly grateful to Kevin because, again, without this, whatever, it's been incredibly informative and really kind of a lot of kind of, sensible advice that hopefully will help you in the future in the care of your dog. And again, just to repeat, this webinar will be up on the YouTube channel for the alumni relations team. So without further ado, it's 5 o'clock and we have to call it there. But again, Kevin, on behalf of everybody listening, and a huge thanks to you for all you've done here. Thanks.
You're very welcome, and thank you everyone for attending.
Okay. Cheers, folks. Take care. Have a good evening. Bye.